How are you doing?
Hello. So glad to be here again.
Yes. It is Children's Dental Health Awareness Month, and we have had so many educational and support series this month to educate our parents and our kids all about the different facets that go into going to a dentist. So we had an HIE Peer Perspective series with Dawn Hamilton and Dr. Matt Mara, who's also an HIE dad. And they discussed how they navigated their own dental appointments. And then we had an educational Q&A with Matt Mara, again, about dental disparities with medically complex children. And now we get to talk with you, our child life specialist, about how to cope during a dental visit and procedure, because we know, can I say it? Like, going to the dentist isn't always the most enjoyable experience. And then when you add medical complexity on top of that, all of those heightened sensitivities and just the physical and mobility needs that our population has, it doesn't always make for a great experience. So we're so grateful to have you to help us navigate and hopefully overcome those challenges. So thank you so much again for being here.
Yes, absolutely. I am happy to be here again to talk about this because I think you're spot on with dental appointments. Sometimes it's the same as going to the doctor. It can be very stressful or scary for adults too. So for kids, it can definitely be scary. So we're hoping that we can share a few ideas and suggestions that can help kids and their families when they have these appointments.
Yes. And my daughter's going to the dentist tomorrow, so this is great timing for me.
Perfect.
Maybe, did I manipulate that in scheduling? Maybe.
Yeah.
So as always, before we begin, can you please identify who you are, what you do, what a child life specialist is, and the scope of your work for Hope for HIE?
Yes, absolutely. I am Annie Gunning. Like Deanna said, I am the child life specialist for Hope for HIE. I'm also a certified grief counselor. So as a child life specialists are typically found in a hospital setting or medical setting, but also most recently in the past several years in the community setting. So we help patients, children, and families cope with stressful situations and empower and support them and their caregivers to advocate for their needs, to decrease stress, pain, anxiety. So we provide that psychosocial support. And, especially within like a hospitalization or a healthcare setting, we provide preparation. We discuss an individualized coping plan. We do some creative expression, some medical play, that education on the diagnosis or whatever that procedure or test is. Anything that we can do to support the child and the family, including the siblings, to help them understand what is going to be happening and help them come up with that successful experience.
Awesome. So if you want to get right into it,
let's do it.
Let's do it. We will begin by asking what strategies exist out there to help parents of medically complex children prep prior to their dental procedure. What can they do? How can parents, for instance, address specific medical concerns or conditions their child may have with the dental team before the appointment?
Yes. I think one thing you can start with is talking with the dental team or the staff about any specific sensory needs that your child has and what coping strategies work well, what things do not work well, what things stress them out, and the best ways to communicate with your child about the dental process. And then advocate for your child for what they will need to have a successful visit. And I think when you're having that conversation with the staff, sharing things like if they have a particular aversion to certain things, like is it the toothbrush spinning and your child that that's something they're not going to be able to tolerate, like what are the alternatives? Can we use a regular toothbrush, or is it the suction that they use? Is it the sound or the feeling that's going to really kind of be a trigger for your child? What else can we do instead of that? So kind of letting them know what your child needs and things that you already know help your child cope will be a great place to start. And then, does your child need to know everything that is going to happen right before? Maybe a lot of times kids like to know exactly the steps of things that are happening. So you can tell the dental team, like, step by step, if they're going to be using the toothbrush and it makes that buzzing sound, you're going to be hearing a buzzing sound. That's the toothbrush. Or now I'm going to squirt the water. That's going to feel cold. Like maybe your child needs those things to know them ahead of time or as they're happening. Maybe your child does not. So you want to make sure they know not to show that. Another thing you can do is call the office prior to a visit, just to understand the process and the step-by-step experience or the appointment of what's going to be happening. So then you can provide the best preparation possible for your child. Like, what is exactly is this going to entail? And then you can prepare them using sequential sensory information. So the step-by-step, and then what are they going to be intaking in their senses? What are they going to be seeing, feeling, tasting, smelling? Give them the order, and then how that's going to, affect their senses. And then if possible, tour the office and meet the staff before a dental visit. And I know this is not possible. Everybody already has a million appointments and things to do. It's hard to do that. If it's possible, going there and seeing things when things are not stressful and nothing has to be done can be very helpful. So I used to work in just an outpatient clinic, and there was a couple kids that we did do this with. And they would come in and stand on the scale. We would check a blood pressure. So it could be the same thing. Like, they sit in the chair, they see the bright lights, they taste the toothbrush, things like that. So introduce it in a stress-free manner. And then we can talk about, if that's not an option, other things we can do as well.
Yeah. Dr. Matt Mara had some really good advice for parents, because he also advocated, just like you, for parents to kind of have advanced conversations, if possible, like even take a tour of the dental office before you go. And he mentioned that if the provider you're working with isn't willing to make those accommodations or willing to engage you throughout that process, then maybe that's a marker of like not the best fit. Like a provider who's willing and able to do that is is someone who you're willing to like work with, and like form a partnership. There's so many things that come into play though, like where you live. Like we have one dentist here, and then we have to drive an hour, so there's so many factors, but it's worth having the conversations, like you said, and it's worth making those requests to see if they're even doable.
Absolutely. And I agree. Like, if the office is like, we don't do that, I feel like that's your first clue into, then they probably don't if they can't do that, they probably don't make accommodations in a lot of other ways too, or, are able to make exceptions or work with you or your child. Yeah, for sure.
Yeah. Now, we also have a question here. Are there communication techniques that you can suggest to parents or caregivers that they use to help their child understand the purpose of this dental visit, appointment, or even procedure?
Yes, absolutely. So again, by visiting the office prior to an appointment, but you can also do this with play. So the point of doing things like that is to address any fears or misconceptions that you have, that the child might have. And then that allows you time to talk about those and play through them before the actual appointment. So it's, even if you're not going to the office, you're talking about it before, maybe you're reading books. Another suggestion is doing just dental play. It's like medical play, but then you can actually kind of see where their misconceptions are and practice coping skills too while they're playing dentist. So you can do something like you play dentist office, and you might want to use dolls or stuffed animals or superheroes or, whatever your kid is into, and get some toothbrushes out or use flashlights. You can get like little mirrors, things like that, and let the child be the dentist to the stuffed animals, or you and your child take turns. And just showing them, like having them leaning back in a chair and, using the mirror and pretending you're looking in their mouth and having the toothbrush, just having that experience can kind of get them ready. And then that's when you also learn, like, oh, you're going to poke me, or they say things and you're like, oh, that's not actually what is going to happen. This is why you get to explain to them why we're doing something and how things are actually going to feel. Mm-hmm. So playing that dentist office just in a non-threatening, fun way is very helpful for kids. There's also a couple like different play sets you can get. Like there's a Play-Doh dental set. There's a Melissa and Doug dental set.
Mhm.
Playmobil has a dental set. So all those things just help kids kind of play through those fears and then address, you get to address any of those maybe misconceptions that they have.
Yeah.
And then
It's
if you,
really smart.
like I said, if you can't go to the office, there's books you can read. And it also addresses the why. Why do we have to go? It's important to take care of our teeth. We have to make sure your mouth and your teeth and gums stay healthy and strong.
Yeah. Those are wonderful suggestions. And then I know you mentioned before talking through like the sequence of events. So do you have suggestions, like if you could model kind of what that looks like for a parent or a caregiver, that would be amazing.
Yeah, of course. So you could start with something like, first we're going to, you could start at the very beginning, and some kids need to go at the very beginning. Like, we're going to check in and we're going to give them your name, and then we're going to sit and we're going to wait. And then they will call your name. You're going to lay back in a chair, and you can practice this at home. Like if you have a recliner or sitting, on the couch with a pillow, and you're going to open your mouth, and you can practice that. You can just practice that, and you can have that flashlight, like I said, in that mirror. And then you can kind of go into the coping. Sometimes it can be hard to keep your body still while the dentist looks at your mouth. Maybe you can hold a squishy or a stuffed animal or someone's hand. And then you just kind of keep going. The dentist and the hygienist, which is the dentist helper. And I know the hygienist is much more than that, but for the sake of explaining it to a child, they will use different tools, and they're going to check your teeth. You might feel pressure as they count and clean your teeth and gums, and then show kids what pressure feels like. So I used to do this with kids, and I would show them the difference between like a poke, like a pinch, and then pressure, pushing. They might feel pressure. That's a difference. They have a tool that squirts water and a straw to suction out the extra water and spit. So again, we're just kind of going through the sequence events. Sometimes you have x-rays, and this is a special camera that takes pictures of your teeth, and your job is to lay still while they take the pictures, and it doesn't hurt. And then they will use a toothbrush that makes a buzzing sound. It spins around and it vibrates, and that cleans your teeth. And next we use floss, and that's like, a little string that goes in your teeth. So idea of how you can explain sequential sensory events.
Yeah. And I know there are accessibility issues to take into place too. The dental office, if it isn't always the most accessible, there are narrow hallways, narrow rooms, huge oversized recliners, x-ray machines. And for children with various mobility needs, that can be really difficult. So we learned this past month that while it may not work for everyone, there's also like a lap to lap type of position where like the child, if they're size or age appropriate or whatever, can like sit on the parent's lap and kind of straddle, if you will. And then the parent can kind of lean back and forth with them. So that way the parent's face is what the child sees as opposed to the dentist's face. So there are things that you can play around with, hopefully, to see what works for you, what works for your family, and what the provider is willing to help you do as well. So,
yes,
cool.
Definitely.
Now,
positions. Yep.
Yeah.
Sure.
I think with everyone, the waiting period before going into any type of appointment is or can be stressful. So do you have any strategies or advice for parents to use to help alleviate or mitigate some of those stressors while their child is, let's say, like in the waiting room or like even the drive to the dental office where the tantrums or the nerves can take over?
Yes, definitely. Yeah, for sure. I think everybody right before something's going to happen that you're not sure of, you get a little bit nervous and anxious. Doing something that they enjoy, whether that's listening to some music in the car that that they like or that's calming, or you're reading some books, just whatever is calming and relaxing to them typically is good to continue, that feeling while they're in the car or while you're sitting in the waiting area. But you can also create beforehand a coping kit. So you can have a little bag or a little box or something, and have the child add items that create a safe and calm kind of feeling, and give them the choice of what they want to put in there. Is it like a little stuffed animal? Is it a stress ball? Do you want to put in sunglasses? Like I used to use sunglasses in the emergency department all the time when we had to do stitches, because those lights are so bright. And for some kids, that's a lot. And it's just, sensory wise, it can be a lot to take in. So do you want to put sunglasses in? And then come up with a break signal. Like some kids, when they're getting really anxious or nervous, like you get to a point and they need a break. So what's a signal? We'll make sure we tell the dentist about your signal. Is it a thumbs up? Is it a tight fist? Whatever your signal is. So kind of going through like that, the coping plan and having that kit of things that make them feel safe and comfortable can be helpful.
Yeah. And maybe in advance, like considering what that threshold looks like, when and where that is. Because another recommendation that we've learned about this month too is not necessarily finishing the entire dental appointment. If it's just a visit, like a checkup or a cleaning, maybe doing half the mouth or the top or the bottom, and then coming back later to finish the rest, to shorten the time period and just make it less all day type of,
Absolutely. Yep.
Now, coping, this was all, so far we've talked about what to do before. So now let's talk about what to do during. What are some coping strategies that you suggest parents, caregivers, anyone in the family who's bringing their child to the dentist, what can they do to help with coping during the appointment so they can have a more enjoyable experience?
Yes. So, we've already mentioned like touring and kind of practicing beforehand. So doing that practice of that appointment, like we said, as the children are, as you're talking about it, just going through those steps and practicing what that's going to look like. And also, I think giving them the tools of like, if you're feeling scared, or, giving them the words to use. So you have to kind of role play a little bit, and that can be really helpful. If you feel really scared and the doctor asks you if you're okay and you're not, you can say no, and then tell them you tell them what you're scared about. You can say, I'm scared that what you're going to do is going to hurt my teeth. Like giving them those words and role playing with them can be really helpful, because when you're in a vulnerable situation, scared, it's hard to kind of think and come up with what you want to say. And they're kids, so they don't always know what to say. And then communicating with the dental team and who else, is around. What if there's other, if there is a child life specialist in there, watch for the child's stress cues. So this needs to be a conversation that the family needs to have, the parent needs to have with the dental team before him. Like you just mentioned, when we do need to take a break, and everybody's stress cues are different, but what are their stress cues and when do we need to take a break? And what is their signal? Because if they get too far along and they get too stressed out, we're not going to get them back. And then it's going to end. And then it's going to end badly. And it's going to be more scary the next time. So we want to end before everybody's at their limit, right?
Yeah.
So like you said, today's goal, we're only doing the top teeth. That's okay, right?
Yeah.
And then just validating their feelings and providing them reassurance and offering them viable choices. Like, you seem like you feel scared. It is okay to feel scared when you are doing something that you're not used to, or that we're doing a test that you're not used to doing. We are here to keep you safe and make sure your body stays healthy. Those are the kinds of things that you want to hear from parents and from the dental team, for the child. And then viable choices. This is a huge one for me, because nurses or doctors, like in the healthcare setting, would always say, okay, are you ready for me to take your blood pressure? Are you ready for me to take it? And kids are always saying no, they're not. So that's not a viable choice.
Right.
I'm going to need to look into your mouth. Do you want me to count to 3 or do you want me to count to 5? And then I'll look. So it needs to be viable choices. That's what the team needs to be doing.
That's really smart, kind of reframing what those questions look like and making them less yes or no questions and making them more of a this or that type of situation.
Yeah.
And then I like that, because then it makes them feel like they have some control over their situation.
And that's what we want to give them. We want to give them control in a situation where they ultimately don't really have a lot and they feel like they don't have a lot. So by giving them those little choices, they get some of that control back, and it just helps them feel more empowered, which is what we want.
Yeah. Now you mentioned, like you said, you've used sunglasses before. Are there other items, and I know it's going to differ with each age group, developmental group, but are there other items that you can like suggest that would help with that stress reduction plan that they could use during the appointment?
Yeah, having that still, if you have that coping kit with you and they bring that,
Yeah.
whatever kind of comfort safety items they want to bring with them. But yes, sunglasses, headphones, whether it be sound canceling headphones or some headphones with some music, whatever music they like, movies. A lot of dentist offices have movies that the kids can watch or games, things like that. Maybe talking to the office before and seeing if they have those things, if those are an option. The comfort positions, like you mentioned that already, Deanna. So having your child sit facing you or laying back and have the child back to chest on you so that you're still snuggling them, you're hugging them, you're talking to them, you're soothing them the way you normally would, but they can still get the exam performed. So that's another option. And I feel like there's times when we do get pushback on this one, but I just want to say, like, your child best. So if you think this will work for your child, it doesn't work for everybody, advocate for them.
Yeah.
You know that snuggling your child and giving them maybe that pressure and that comfort from you will help them.
Yeah.
And then listening to a story or even a podcast or finding a new podcast that they haven't heard, holding that comfort item, a weighted blanket. Those are just some ideas of, things that we can try.
Yeah, I love those. So we know life is not perfect. And even though we prep and we plan and we have strategies, there are times when things just go wrong. I feel like that happens every day, every minute of every day.
Yep.
So what, in the event that a child does have some challenges, whatever that looks like during the procedure and is showing signs of like severe stress or resistance, what can we as parents or caregivers, and also what can even the professionals who are there, what can they do to help?
Yeah, I always will think, oh, I have this grand plan and this procedure is going to go like beautifully. And then, like you said, it doesn't, right? So you got to have something in your back pocket or try to figure out what's going to help. And something that I mentioned before, take a break, because I don't know how many times I would hear a kid like crying or whatever, and then they'd call me and be like, hey, can you come and help? And at that point, when a kid is already screaming and yelling and you've lost them, you really can't get them back unless you completely break, you leave the room, everything's done. And then even trying to get them re-engaged to what you need to happen is going to be very difficult. So taking that break and just kind of noticing what their cues are is really important. Like, do you see them getting tense? Do you see them starting to get scared? Okay, let's change their focus for a minute. Let's get them engaged in a conversation. Let's start singing a song. Let's play I Spy, something to kind of get them calm again, because we don't want to lose them before it's too late.
Yeah.
And ask them what's going to help you right now. Ask them, they might know what's going to help them or what they like. And ask them what their fear is. Usually it's a misconception. I'm afraid that machine over there, because think about it as a kid. You walk into a room and you see all of these things. You think everything in that room is going to be used on you. Yeah. And that can be scary. So I'm afraid you're going to use that machine. It's going to hurt my mouth. Oh no, that machine is for XYZ, whatever it's for. So just kind of asking them, what they need and how you can explain things to them. And those viable choices are valuable. You have to give them choices. I always like to make sure we talk about, for all kids, safety boundaries, validate how they're feeling. It is okay to feel scared, but if kids start getting, really anxious and scared, you don't want them to hit. Like, you can, but you can't hit.
Right.
You can squeeze my hand and we can play a game. Like, let's pretend we're frozen. We can only blink our eyes. You can do things like that. But setting that safety boundary is just important for everyone as well.
Yeah. Yeah. And we all know that that's a very realistic reaction. I know my kid tomorrow is going to kick and scream. I know it.
Yeah. Toddlers are the strongest people in the world. They're like wrestling alligators.
I don't understand. I'm like, I was in the choir. Like, girl, I didn't do anything athletic. Where'd you get your strength? Like, I've seen your father, like, what are you doing? I
Toddlers
don't
were
get
the
it.
hardest group that ever came in the emergency department. I was like, oh gosh, this is gonna be like
Insane.
wrestling an alligator.
It's
Like they are
insane.
so strong, all of them. It
Yeah.
does not matter. They are all strong. So
Mm-hmm.
yeah, like, and I mean, obviously with a toddler, I'm not saying like they're little, they're scared. That's just how they react. But I'm talking about an older child. It's
Mm-hmm.
important to set those boundaries of like, I know you feel scared, and I would feel scared if I were you too, and that's okay to feel scared, but we need to make sure you stay safe and we all stay safe. So let's squeeze my hand instead or whatever.
Yeah.
And then offering just an alternate focus for distraction. Change the movies, change the music, start talking, have a conversation about your favorite things, ask them questions, play I Spy in the room. So they just have to look around.
Yeah.
And then I think for families, it can be helpful to come in with like an all about me is great so they can learn about your child. Like, especially if your child doesn't have a lot of words or, language, coming in with like a paper that just has like, this is me, this is how old I am, these are my favorite things, these are things that scare me. These are my pets, these are people in my family, just to kind of give you a little bit of that. You can do that instant rapport building, and that helps a child just feel more comfortable and safe as well.
I love that idea, especially because a lot of feedback and concerns that we hear from people in our community are, when you go to the dentist twice a year, let's say, and there's just not enough of a cadence, like a standard cadence of care to really emphasize or build that relationship.
Right.
Like they have with other providers who maybe they see or talk to way more often. So I think any step that, we can take to help let them know like who our kids are and like what they like and just as a human, this is what helps me.
Yeah.
I think that's a really smart idea.
And, as a staff member who worked in the hospital for so many years, like I would love that. If a parent came in and was like, hey, here's my kid, here's some things you need to know about my kid, like right off the bat. I mean, I would love that. I think that would be really helpful, just to be able to work with them and help them. I'm
telling you what, I'm going to make one for my daughter's appointment tomorrow. That's brilliant. It's brilliant.
Yeah. And you can find really cute ones on like Pinterest, Canva. I mean, you can find them anywhere.
Let's be real. We all know I'm going to get off this call and make one with Hope for HIE branded on it.
You will. You will.
We will.
We should.
We will.
Yeah.
We will. Okay. So that's actually the perfect segue because now we're going to just talk about tools and resources. And I know there's a plethora of them. So we will make sure that we list them all nice and pretty and on our blog and our takeaways, et cetera, and on the Child Life On Call app too. But what are resources, books, just things, I guess, that I hate that word things, but what are things you recommend for parents or family members who want to learn more about how to support their child during a dental procedure, how to help them cope and just make it a better experience?
Yeah, so most of these are just really ideas just to help your kid kind of prep them and a couple resources for parents as well. But of course, you already mentioned the Child Life On Call app. That has a great section for, I think it's under, if you go under parents and then like resources, there's like a dental page. So, and that will give you a list of like books and podcasts and different websites and things like that. So, and then if you do really make the all about me, we'll put that on there too. But the Child Life On Call app does have great resources. And then look on your dentist website or any dentist website, or you can go to YouTube. So if you can't go to that dentist for a tour beforehand because it's very hard to do, they will have pictures on their website of like, this is the front office. This is what the room looks like. Then you can kind of explain the machines, and just showing them the pictures beforehand is a great option. Like if you can't get there, it really can help because then it just kind of gets them thinking a little bit ahead of time. And I should say for like younger kids, like preschool, you only really need to do that like a day in advance. And then you kind of add more days as they get older. So like for if you have an older child, like a high school child or middle school, you could do it like 4 or 5 days in advance, 6 days, give them time to think about it. But you know your child best, but that can be definitely be an option. And then I have some books that we'll post. Going to the Dentist, Daniel Goes to the Dentist. And I don't need to read all those, but we'll post those up. And then Sesame Workshop has some great like short videos about teeth and going to the dentist and keeping your teeth healthy. So if we make it fun and playful and enjoyable, it doesn't seem so scary either. And then I know you talked about Dr. Mara, who was on recently, but I actually looked back on our blog too, because I knew we did a dentist Q&A last year.
You did.
Yeah, Dr. Juan Yepes, and he had some great, so his information is posted from his Q&A, and that had some great information on there as well. And then he also suggested the Special Care Dentistry Association, because if you need a dentist, you know, finding a specific dentist to help families, you know, with special care needs and things like that, that the Special Care Dentistry Association might be able to help you find one near you, if that's something specific that you need.
Yes. And that's another great segue into, you know, there are resources if you're part of our Hope for HIE community that you can utilize. Like you said, Child Life on Call. Every situation is different. So when we do Q&As like this, you know, we really try to go across a range of impacts and outcomes, but that would take the full day, right? So if you need a specialized plan, you know, curated to your needs, please reach out to Annie. And you do that by visiting HIE.support and clicking on Annie, essentially. And then you can work with that family. I know you've done it so many times before. You've been a wonderful resource for them just to help. And that way, you know, it's less of a general conversation and just more of what can we specifically do, because here's my kid and here's what they need.
Yes, definitely. Yeah. Please do. That is what I'm here for, to come up that individualized plan, coping plan suggestions, and just to talk you through something. If you just, you know, want to talk through, this is how your child's reacting, please call me. That's why I'm here.
And I know I've mentioned it before, but we've had so many resources this month. Like we had the HIE Peer Perspective series where Don Hamilton and Matt Mara talked about their experiences as parents, you know, navigating their kids' oral, motor, and dental health. And then we had that Q&A with Matt Mara again the following week. So and like you said, that previous interview that we did, over the summer, I think, where we just, he talked about all of these common issues, like dental issues that happened and the role medications play. We're trying very hard to build our health literacy resources for this topic because we know there's not a lot of research. So thanks to Dr. Matt Mara as well. He is an oral researcher out of Boston University. He does research out of Boston University about oral motor and dental health. And he made a survey for our family members and our community members to fill out. And that is something that it's on our social pages, and we'll make sure to link to, because parents can play a role in shaping that research. They can add their input. And the whole point of it is to isolate these variables and these causes for like disparities in dental health and like the types of dental health issues that are commonly seen throughout our kids. So that way we can kind of isolate what the issue is and then create like a real solution for it, hopefully later on. So your input is needed and your input is valuable. So we want to make sure that you take advantage of that resource and to help shape that research. So thank you again, Annie. It's, as always, so nice talking with you and getting a piece of your expertise. And until next month, we say goodbye and we'll see you.
Thanks, guys. Bye.